So today we're going to be talking and learning about burns, first degree, second degree, and third degree. All right, so first degree burns. First degree burns are very minor. So with this, we'll also be talking about how it affects the different layers, the look and symptoms, and then the cause for each degree of burn. So with first degree, it affects the epidermis. The epidermis is your top layer of your skin, that just very top layer. Then the look and symptoms that you might have if you have a first degree burn, it'll be very red and it'll be very painful for about like 2 to 3 days or so. And also you'll have some swelling and you will not have any scarring. Another thing with this is it will be very dry as well with this type of burn. What causes this type of burn is one, sunburn is very, very popular. And then the second one is like touching a hot object. So as you can see, the pictures I have on the board here. So the first one, the top left corner, is a sunburn. And he kind of got it all over his chest and his stomach. That's very red, as you can see, and it's very dry. These two photos, these are a picture of someone who may have touched a very hot object and caused a first degree burn. The treatment for a first degree burn, usually you do not have to go and seek medical attention. You can usually do a lot of home remedies for this and just treat it at home. So some of the steps you're going to want to take is one, you want to make sure you remove any clothing on or around that burn area. Then two, it's really important to cool the area down. So make sure you run your burn under cold water for about 5 minutes at least, maybe up to 30, or until that pain subsides. Then three, you want to apply some petroleum jelly. This is really nice because it will help soothe the area and also will help with that healing process and make it a little bit quicker. Then four, you could take some medication like ibuprofen, which will help with any swelling or any pain that you'll be experiencing because this type of burn is very, very painful for at least those couple of days. And then five is the most important step. A lot of people will forget this step. You want to make sure you wrap the burn. Wrapping the burn is very important because if you got sunburn, you don't want to make that sun come onto that burn again and have contact. So making sure you cover it with some gauze and making that very loose. Some things you do not want to do is you do not want to apply butter instead of like a cold compress because butter has a lot of properties in it that can actually cause an infection. And a first degree burn is very low risk for infection, but butter will increase that risk for infection. Second degree burn. This is a very mild to moderate type of burn, and it will affect the 2 layers of your skin. So that's your epidermis and then your dermis layer. And as you can see on the photo, it shows at what point second degree burn affects into your layers of skin. So the epidermis is that very top layer right about here, and then the dermis, your second layer, goes until right about there at the very bottom. And that's just where it all affects. Some of the looks and symptoms, it'll be very dark color red, also be very shiny, kind of wet looking. You will also experience some blisters with a second degree burn. It'll be very painful as well, even more than a first degree burn. Then you will have swelling, and as the healing process continues, you will actually have some peeling of the different multiple layers of skin because it damaged both the first and the second layer of skin. The cause is typically from fire, so like burn survivors will have usually a second degree burn. Sunburn, so ultraviolet rays, so this is even more severe than a first degree burn. And then chemical, electricity, and boiled water. So if you're cooking and you're boiling water, you actually spill it on yourself, it could cause it a second degree burn. And these pictures just kind of show the difference of what it would actually look like. So as you can see on the right here, the guy's shoulder looks very, very painful. It's very shiny and wet, kind of glistens off from like the sunlight. As you can see, there's swelling as well and very much a lot of blisters all around. And then this one as well, just a little bit more smaller of a burn, but it also still has those blisters. It's very wet, very painful looking. Treatment for this. So you can still typically treat most of them at home if it's less than 10% of your body or if it's less than 3 inches on your body. This will typically take about 1 to 3 weeks to heal fully for a second degree burn, maybe sometimes even up to 5 weeks, but typically in that 3-week mark. For the steps for a home treatment, is one, you're going to make sure you wash your burn. Washing your burn is really important because you want to make sure you run it underwater for 5 minutes or until that pain stops again. You don't want to use ice because that will actually damage your nerve cells. And at this point, those nerve cells are not damaged. So if you do that, that will happen. Then second, you want to make sure you wash your hands. Making sure you wash your hands is important because it will prevent from any infection, because a second-degree burn, you are at a pretty high risk for infection. So making sure you wash those hands before you further touch it is important. Then 3, clean your burn. So it's important to use a very sensitive type of soap. So you could use like a bar soap and some water in order to just lightly clean that area. Then 4, you want to make sure you dry your burn, and you want to make sure you use like a soft paper towel or a soft just towel in general and just pat dry it. If you rub it super hard, another layer of your skin will come off and be even more painful. So you don't want to do that. 5 is your ointment. You could put, again, petroleum jelly on it, or you could put an antibiotic type of ointment on it to help with that healing process. And then 6, again, you want to wrap it. Use that gauze. Make sure it's very loosely wrapped. Otherwise, if you encircle your burn, if it's on your arm or your leg, it can actually increase your swelling. So that's not something you want to do. Some things you do want to do is you want to make sure you wash your burn every single day because, like I said, second-degree burn, you're at a high risk for infection. And when you wash it, and if it gets wet at any point, you want to make sure you rewrap it at all times, again, for that infection part. And if your burn is either on an arm or a leg, some type of limb, it's really good to elevate that in order to reduce any potential swelling. Third-degree burn. Third-degree burn is a very extreme type of burn. With this, it affects every layer of your skin. And as you can see up on the board here, this is the first-degree burn. The epidermis is right about there. The second degree is the dermis, your second layer. Third degree, it goes all the way down through every single part of layer of your skin. And so it affects the epidermis, the dermis, and the hypodermis. That's the third layer. Also, it can affect your tissues, muscles, some bones, and the big one here is your nerves. So your nerves will actually be very damaged and even dead, which is why a lot of times you will not feel pain in a third-degree burn. And a lot of times people will think that they're fine when they're actually not because they don't feel pain, but you've actually damaged all those nerves, which is very, very dangerous. So the symptoms and what it might look like is it'll be very brown, it could be black, very charred kind of looking type of burn on your skin. Also, it'd be very dry, kind of leathery looking, kind of like these pictures. You will also sometimes have swelling, even blisters like a second-degree burn. Those kind of tie over to a third-degree burn as well. Other things is the white tissue actually will show through because you've damaged all the muscles, the tissues, and the nerves. So white tissue will actually come up from underneath the skin. You will more than likely have a scar with this type of burn, even if you treat it properly, just because it's just damaged all your layers of your skin. The cause of a third-degree burn is typically, again, from like a fire. If you're cooking with grease or oil and that gets spilt on you, again, that can also cause a third-degree burn. Chemicals like acid, those are very strong, and those would definitely damage all layers of your skin. Radiation and electricity as well. And as you can see, these pictures, they both are very charred looking. They're very flaky too, kind of. Certain parts it looks a little wet, but other parts it looks very dry. And they're very black and brown and very cracked as well. Treatment for this. So if you have a third-degree burn, you cannot do a home treatment. You have to seek medical attention right away. That's really important. With this type of burn, it may take weeks to months and even sometimes a year to fully recover from this burn. And the steps that will be taken at the hospital when you do seek medical attention will be, one, again, they're going to be cleaning that burn. They want to make sure they remove any like debris or damaged skin on that in order to help with that healing process. And then 2, they're going to put an ointment on, probably an antibiotic ointment that they prescribe you. And then again, they're going to wrap that area very loosely with some gauze that they have at the hospital. This is where it gets a little bit different from a second or first degree burn. So they're actually going to give you antibiotics. They're going to give you antibiotics because a lot of times you're going to have infection with a third degree burn. It's very, very likely. And so this will be given like orally through a pill, or they can actually inject it through a vein in your arm. and this just prevents from fighting off any infection that you potentially have or you may end up having in the future. Also, fluids. They're going to be giving you any fluids because with a third-degree burn, you actually will lose a lot of bodily fluids like blood, things like that you may have lost, and that just gets replenished through those fluids. Then they're going to prescribe you some medication or prescription to help with any pain, even though you don't feel any pain since you damaged the nerve cells with this. But as the healing process goes on, you will experience more pain, and so ibuprofen and things like that will just help subside with that type of feeling. And then lastly, this is their last resort, is surgery. This is if it's a very extreme type of third-degree burn or it's a very large amount on your body. They will do this, and it's called skin grafting. Skin grafting is just where they're going to take a healthy part, skin patch from another part of your body and actually apply that to cover your burned area for that third-degree burn. That just helps with that healing process again. So that's all I have for you guys today. Those are the 3 different degrees of burns. All right, I hope you guys have a great rest of your day, and I will see you next time.